Welcome to MCQ Test Prep. Ready to test your CCMA knowledge? Challenge yourself with 25 updated safety and infection control questions for the 2026 exam and see how many you can answer correctly before the answers are revealed. Question number 1. Attention future CCMAs, this is a must-know safety question. While preparing an exam room, a certified clinical medical assistant notices that the disinfectant solution used to clean high-touch surfaces has expired. What is the most appropriate action? A. Use the expired solution if it still appears clear. B. Mix the expired solution with a fresh batch. C. Discard the expired disinfectant, prepare a new solution according to facility policy, and disinfect the room before the next patient enters. D. Wipe the surfaces with water instead. Answer: C. Expired disinfectants may not effectively eliminate pathogens. Fresh solutions prepared according to manufacturer instructions are necessary for proper infection control. Question number 2. Exam alert, this topic is tested often. A patient arrives with a persistent cough and reports a recent fever. Before escorting the patient through the waiting area, the medical assistant should first A. Ask the patient to complete paperwork before taking any precautions. B. Offer the patient a mask if indicated by facility policy and promptly notify the appropriate clinical staff while minimizing exposure to others. C. Immediately begin collecting laboratory specimens. D. Seat the patient next to individuals already waiting. Answer: B. Early identification and source control measures, such as masking symptomatic patients, help reduce the spread of respiratory illnesses. Question number 3. Patient safety starts with questions like this. During venipuncture, the medical assistant accidentally touches the sterile needle after removing its protective cap but before inserting it into the patient's vein. What should happen next? A. Wipe the needle with alcohol and continue. B. Use the needle since the contact lasted only a second. C. Replace the contaminated needle with a new sterile needle before performing the procedure. D. Continue if the patient agrees. Answer: C. Any contamination of a sterile needle compromises sterility. A new sterile needle must always be used. Question number 4. Let's see how well you know infection control. Which situation requires the medical assistant to perform hand hygiene even if gloves were worn throughout the procedure? A. Only after visible contamination is present. B. Only after treating patients with infectious diseases. C. Gloves eliminate the need for hand hygiene. D. Immediately after removing gloves because microscopic contamination may still occur. Answer: D. Gloves reduce contamination but do not replace hand hygiene. Hands should always be cleaned after glove removal. Question number 5. This is a key concept every CCMA should master. A specimen containing blood is accidentally dropped, causing a spill on the laboratory floor. What is the best initial response? A. Cover the spill, restrict access to the area, and clean it using the facility's bloodborne pathogen spill procedure with appropriate PPE. B. Mop the spill immediately without gloves. C. Wait until the end of the day to disinfect the area. D. Cover the spill with paper towels and continue working. Answer: A. Blood spills require immediate attention using approved exposure control procedures and appropriate personal protective equipment. Question number 6. Think carefully before choosing your answer. Which patient interaction presents the highest risk for exposure to bloodborne pathogens? A. Measuring oral temperature. B. Assisting with paperwork at the reception desk. C. Performing a fingerstick blood glucose test. D. Taking a patient's blood pressure. Answer: C. Fingerstick testing involves direct contact with blood and requires strict adherence to standard precautions. Question number 7. Many students miss this one, don't be one of them. Before removing a contaminated isolation gown, what is the most important principle to remember? A. Remove it slowly while avoiding contact between the contaminated outer surface and clothing or skin. B. Shake the gown to remove loose contaminants. C. Fold the contaminated side outward before disposal. D. Leave the gown on until the end of the shift. Answer: A. Proper PP removal prevents transferring microorganisms from contaminated surfaces to the healthcare worker. Question number 8. Here's another important CCMA exam question. A medical assistant notices that a sharps container is filled above the recommended fill line. What should be done? A. Compress the contents to create more space. B. Continue using it until completely full. C. Replace the sharps container promptly according to facility policy before additional sharps are discarded. D. Empty the container into a trash bag. Answer: C. Overfilled sharps containers increase the risk of needle stick injuries and should be replaced before reaching capacity. Question number 9. Safety first. Can you identify the correct answer? A reusable blood pressure cuff becomes visibly contaminated with body fluids after a patient encounter. What is the most appropriate action? A. Wipe only the visibly soiled area with a dry towel. B. Clean and disinfect the cuff using the manufacturer's recommendations before using it on another patient. C. Allow the cuff to air dry without cleaning. D. Place a disposable sleeve over the contamination and continue using it. Answer: B. Reusable equipment contaminated with body fluids must be properly cleaned and disinfected before reuse. Question number 10. This question could appear on your certification exam. During vaccine administration, the medical assistant accidentally experiences a needle stick injury after activating the safety device. What should the medical assistant do first? A. Wash the affected area immediately and report the exposure according to facility policy. B. Continue seeing patients before reporting the injury. C. Cover the injury and wait until the end of the shift. D. Attempt to squeeze as much blood as possible from the wound before telling anyone. Answer: A. Immediate wound cleansing and prompt reporting are critical components of occupational exposure management and post-exposure evaluation. Question number 11. Stay focused, every detail matters. A certified clinical medical assistant is preparing to assist with a minor surgical procedure. While opening sterile supplies, the assistant notices that the outer wrapper of one sterile package became wet after being placed on a damp countertop. Although the package has not been opened, what is the best action? A. Dry the outside with a paper towel and continue using the package. B. Open the package quickly before additional moisture reaches it. C. Consider the package contaminated, discard it, and obtain a new sterile package before the procedure begins. D. Ask the provider whether the package still appears sterile. Answer: C. Moisture can allow microorganisms to penetrate sterile packaging through a process called strike-through. Any sterile package that becomes wet should be considered contaminated. Question number 12. Let's test your clinical judgment. A medical assistant finishes cleaning a reusable patient examination table after a procedure involving body fluid exposure. The disinfectant label states that the surface must remain visibly wet for 4 minutes to be effective. What should the assistant do? A. Wipe the disinfectant off immediately after application. B. Allow the disinfectant to remain on the surface for the full required contact time before drying or reuse. C. Rinse the surface immediately with water after spraying it. D. Dry the surface after 1 minute because visible moisture is unnecessary. Answer: B. Disinfectants are only effective when used according to the manufacturer's required contact, dwell, time. Removing them too early may not destroy harmful microorganisms. Question number 13. This is a high-yield infection control topic. While collecting a blood specimen, a patient suddenly moves, causing the needle to come out of the vein unexpectedly. After activating the needle's safety device, what should the medical assistant do first regarding the contaminated sharp? A. Place the used needle immediately into an approved sharps container without recapping it. B. Recap the needle carefully before disposal. C. Lay the needle on the tray until the patient leaves. D. Place the needle in a regular trash container wrapped in gauze. Answer: A. Contaminated sharps should be disposed of immediately in an approved sharps container. Recapping increases the risk of needle stick injuries. Question number 14. Attention students, don't skip this concept. A patient with a known history of tuberculosis arrives for evaluation after developing a persistent productive cough. Before entering the examination room, which personal protective equipment would most appropriately protect healthcare personnel according to airborne precautions? A. Disposable apron only. B. Standard procedure gloves only. C. Surgical mask only. D. A properly fitted respirator such as an N95 when required by facility policy. Answer: D. Airborne diseases such as tuberculosis require respiratory protection beyond a standard surgical mask. Proper respiratory protection helps reduce inhalation of airborne infectious particles. Question number 15. Think like a medical assistant before answering. While cleaning reusable medical equipment, the assistant notices dried organic material remaining inside a reusable instrument hinge after the cleaning process has been completed. What is the most appropriate next step? A. Apply disinfectant directly over the dried debris. B. Repeat the cleaning process until all visible organic material has been removed before disinfection or sterilization. C. Send the instrument directly for sterilization since sterilization removes debris. D. Lubricate the hinge before using the instrument again. Answer: B. Cleaning must remove all visible soil before disinfection or sterilization. Organic material can interfere with the effectiveness of subsequent processing. Question number 16. This is an essential workplace safety question. A coworker accidentally places a clean instrument tray beside a container holding contaminated instruments awaiting transport to decontamination. What should the medical assistant do? A. Separate the clean tray immediately and evaluate whether contamination occurred before it is used on a patient. B. Ignore the situation because the instruments did not touch each other. C. Cover both trays with towels until needed. D. Spray the outside of the clean tray with air freshener. Answer A. Clean and contaminated items should remain physically separated. If contamination is suspected, the clean items should be reprocessed according to policy. Question number 17. Ready for another CCMA challenge? During vaccine administration, a child suddenly coughs forcefully while the medical assistant is preparing documentation. Respiratory secretions land on the countertop beside clean supplies. What should the assistant do? A. Continue documenting and clean the area later. B. Remove only the visible secretions with a tissue. C. Remove any potentially contaminated supplies, clean and disinfect the surface, and replace exposed items before the next patient. D. Cover the contaminated area with clean paper. Answer C. Respiratory secretions can contaminate nearby surfaces and supplies. Cleaning and disinfection help prevent indirect transmission. Question number 18. A small detail can make a big difference here. A medical assistant removes gloves after wound care but notices that one glove has a small tear that exposed part of the skin during the procedure. Even though no contamination is visible, what should the assistant do? A. Wash hands thoroughly because microscopic contamination may have occurred despite the absence of visible soil. B. Replace the gloves only if another patient is waiting. C. Use alcohol gel only if hands appear dirty. D. Skip hand hygiene because gloves were worn. Answer A. Hand hygiene is required after glove removal regardless of visible contamination because glove defects or unnoticed contamination may occur. Question number 19. You're doing great, keep the momentum going. While preparing to perform point-of-care testing, a medical assistant discovers that quality control documentation for the testing device has not been completed according to facility requirements. What should happen before patient testing continues? A. Perform patient testing first and complete quality control later. B. Proceed if the device powered on normally. C. Complete required quality control procedures according to policy before testing patient specimens. D. Skip quality control if the device was used successfully yesterday. Answer C. Quality control ensures testing equipment is functioning correctly before patient results are generated. Question number 20. This concept helps keep both patients and staff safe. At the end of a busy clinic day, a medical assistant notices that several reusable protective face shields appear clean but were worn during multiple patient encounters. What is the most appropriate action? A. Store them for use tomorrow without further processing. B. Clean and disinfect the reusable face shields according to manufacturer instructions before storing them for future use. C. Wipe them quickly with a dry paper towel only. D. Discard all reusable face shields after every shift regardless of manufacturer guidance. Answer B. Reusable PPE must be cleaned and disinfected according to manufacturer recommendations before reuse to maintain infection prevention standards. Question number 21. Let's see if you're exam ready. A certified clinical medical assistant is preparing a room immediately after a patient with suspected infectious diarrhea has been discharged. Before the next patient is brought into the room, which action is most appropriate? A. Replace only the exam table paper because the room appears clean. B. Spray air freshener to remove odors before the next appointment. C. Clean and disinfect all high-touch surfaces and any equipment used during the visit according to facility infection control procedures. D. Wait until the end of the day to disinfect the room. Answer: C. Patients with infectious gastrointestinal illnesses can contaminate frequently touched surfaces. Thorough cleaning and disinfection reduce the risk of disease transmission. Question number 22. Every future CCMA should know this. A medical assistant is transporting several laboratory specimens to the laboratory. One specimen container develops a small leak inside the transport bag. What should the assistant do? A. Continue transporting the specimens and clean the bag later. B. Place the leaking specimen into a new leak-proof biohazard transport container using appropriate PP and follow facility exposure procedures if contamination occurred. C. Wipe the outside of the bag with a paper towel only. D. Throw the leaking specimen into regular trash. Answer: B. Leaking specimens present an exposure hazard. Proper containment, PP, and adherence to biohazard transport procedures are essential. Question number 23. Take your time and think like a healthcare professional. While removing contaminated gloves after assisting with wound irrigation, the medical assistant accidentally touches the contaminated outer surface of one glove with bare fingers. What is the most appropriate response? A. Put on another pair of gloves immediately without cleaning hands. B. Continue working because the contamination was brief. C. Perform hand hygiene immediately before touching any clean equipment, supplies, or patients. D. Wipe the fingers with a dry tissue and continue. Answer: C. If bare skin contacts a contaminated surface during glove removal, immediate hand hygiene is necessary to prevent transmission of microorganisms. Question number 24. Here's another question to sharpen your skills. A patient arrives with a draining wound that cannot be completely contained by the existing dressing. Which infection control measure is most appropriate while preparing the examination room? A. Delay cleaning until after the patient leaves. B. Apply standard precautions and any additional transmission-based precautions required by facility policy while handling drainage and contaminated materials. C. Use only eye protection because gloves are unnecessary. D. Allow contaminated dressings to remain on the exam table until housekeeping arrives. Answer: B. Drainage from wounds may contain infectious organisms. Appropriate precautions, including PP and careful handling of contaminated materials, help prevent disease transmission. Question number 25. Let's move on to the next important safety question. During a routine safety inspection, a medical assistant notices that boxes of sterile supplies are being stored directly on the floor in a storage room. Why should this situation be corrected? A. Supplies stored on the floor are harder to count during inventory. B. Floor storage increases the risk of contamination from moisture, dirt, pests, and accidental damage, so sterile supplies should be stored on approved shelving. C. Floor storage causes supplies to expire more quickly because of room temperature. D. Sterile supplies are always protected regardless of where they are stored. Answer B. Sterile supplies should never be stored directly on the floor. Proper shelving protects package integrity and reduces contamination risks.